currently working around the clock to stabilize our hardest hit long-term care homes. After being devastated by a serious COVID-19 outbreaks, these 5 homes had reached long-term care homes. After being devastated by a serious COVID-19 outbreaks, these 5 homes had reached a crisis situation. And that's why we called in the military for help. We knew these homes were having serious problems and needed help. But until yesterday morning, we didn't know the full extent of what these homes, what these residents were dealing with. The reports they provided us were heartbreaking. They were horrific. It's shocking that this can happen here in Canada. It's gut-wrenching. And reading those reports was the hardest thing I've done as Premier, knowing that so much more needs to be done. But what I am feeling, what we all are feeling, is little in comparison to the hardship that these residents and their families have had to endure. There's nothing worse than feeling helpless when it comes to protecting a loved one. So please, pray for these residents. Please pray for their families. And as hard as this is for everyone, as hard as it will be to hear some of these details, I believe that the public needs to see these reports. You need to know exactly what I know. You deserve to know what I know as Premier. That's why I ordered these reports to be released in their entirety. Right now, our number one priority remains protecting these residents, continuing to stabilize the conditions in these homes and across the system. Each of these homes has a hospital partner supporting them. These hospitals have stood with us through the darkest days. The expertise, knowledge, and dedication of our hospital partners has been absolutely critical. And we will continue to need our incredible hospitals as we move forward. And thanks to the help of our hospital partners, thanks to the incredible work of our armed forces, thanks to their sacrifice and dedication, the conditions in these homes is stabilizing. But there's still so much more work to be done. I'm calling on the Canadian Forces to extend their current mission for another 30 days. I spoke to General Vance last night and again this morning. I thanked the brave men and women of the Canadian Armed Forces. Thank you for putting up your hand. Thank you for going into those homes in crisis. And most of all, thank you for bringing these incredibly serious issues to light. I know the public wants answers, and I promise you, my commitment to the people of Ontario is that I will get those answers. There'll be accountability. There'll be justice for these residents and their families. As soon as we receive these reports, we launched a full investigation into these allegations. This includes an investigation by Ontario's Chief Coroner. The results of these investigations will be shared with police to look into any possible criminal charges. And I will also make the results of these investigations public, because we all want answers. We need answers. That is why I ordered these reports to be released in their entirety, so you can see what I've seen, so you can fully understand what I understand, that we must change the system. This tragedy must serve as a wake-up call to our entire country. And it's no secret that COVID-19 has taken a system with deep problems, a system that has been neglected for years and pushed to the brink. COVID-19 has exposed the deep cracks in long-term care system. And it's up to us now to fix these problems. And it is up to us to face the hard truths that have been ignored for decades. And from our first day in office, we got to work but fixing a broken system, fixing a system that has suffered from decades of neglect, takes time and it takes massive resources and billions of dollars. But we know that we must do better as a province, that we must do better as a country, because this isn't a problem that is unique to Ontario. As Canadians, we must protect those who cannot protect themselves. I spoke to the Prime Minister this morning. I thanked him again for the support of the Canadian Forces. I told him that after reading this report, now more than ever, it is clear there is a need. We must work together. The Prime Minister offered his full support, and I am grateful for the Prime Minister's commitment to working with us to solve this problem, because we need their help if we're going to fix this broken system. A system with hundreds of facilities, tens of thousands of residents and workers. We can't do it alone. We need the federal government at the table as a funding partner. And today, I'm calling on the Prime Minister. Support us as we move forward. Help us fix this problem. We can't fix it alone. No province can fix it alone. As Canadians, we need to protect these residents. My friends, you should expect nothing less. As a province, we should expect nothing less. As a country, we should expect nothing less. And as your Premier, I expect nothing less. I will do everything in my power. I will move heaven and earth to do what is right, to help these people, to help those who need us. That is our job. It is our responsibility, and we will stop at nothing less. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Fullerton.
Thank you. The health and safety of our residents in long-term care homes is our government's top priority. And that is why on April 22nd, our government formally requested assistance from the Canadian Armed Forces at 5 long-term care homes in Ontario that were in crises. These homes faced significant challenges, including staffing, infection prevention and control, resident safety, food preparation, and janitorial services. The findings outlined by the Canadian Armed Forces report are gut-wrenching and appalling. We are taking immediate steps to address the serious findings in the report. 1 death has been referred to the coroner for investigation. In addition to the continued regular inspections, the Ministry of Long-Term Care Inspections branch will immediately investigate specific critical incidents referred to in the report. Thanks to the efforts of the Canadian Armed Forces, as of yesterday, we have seen significant improvement in these 5 homes. And we continue to take this situation seriously and will continue to act fiercely to provide a safe and caring place for our most vulnerable to call home. And as we begin to see our long-term care homes start to stabilize, our government will be launching an independent commission into Ontario's long-term care system beginning in September. We will continue to act to keep Ontarians safe, and we will continue to be transparent with the people of Ontario. We have said all along that our long-term care system needs to be repaired and advanced, and we will do just that for our loved ones. Thank you.
We'll go to the phone line for questions. Just a reminder, it's 1 question, 1 follow-up. First question.
Your first question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. if all of these troubling allegations, observations were made at just 5 homes in the province, I'm wondering what you think is happening at the other homes in the province, and how will you ensure that these conditions are not permitted in these homes, the homes that are in question today, or other long-term care facilities across the province immediately?
Well, first of all, Sean, I'm going to tell you what happened when I received the report yesterday. The first thing I said to the team, our health team, long-term care and Ministry of Health, is number one, we have to stabilize the situation, not just in 5 homes. We have to make sure we go right through the system. Number two, to make this transparent, to put it out to the public until they know what I know. And I've said that from day one. Anything that I receive is going directly to the public after I get briefed within 24 hours. And then we have to put corrective action measures in place immediately, right across the board. And as I've always said, Sean, no, I inherited this system. The buck stops with me. I take full ownership, but my job is to fix a broken system that's been broken for decades. And I can assure the people of Ontario that I'm going to move heaven and earth to make sure that we leave no stone unturned, and we're going to fix the system. No matter what it takes, no matter what cost it takes, I'm going to make sure we protect the most vulnerable people in these homes.
Premier, in light of this report today, I noticed that you're still sticking to this plan to hold a commission of inquiry in September and not a full public inquiry. Why are the findings today not enough to convince you to hold a full public inquiry?
Well, first of all, everything's on the table. I'm not ruling out anything after reading this. My immediate reaction, as I said, is to make sure we stabilize these homes and any other homes. And we did four things off the top of my mind right away. We knew there's a crisis. I came up here many times and saying the system is broken. We have a crisis. We called in the public health. We called in support from the hospitals. We put a call out there for volunteers, and I'm grateful for the volunteers. And the last resort, which is serious, we called in the military. We called in the military, and thank God for the military, the men and women that came in to support us. And I talked to General Vance, and I thank him again. I thank the men and women that had those sacrifices going in there. And as you know, quite a few of them ended up catching COVID. But they went in there, and now we have a clear report of a system that has been broken for decades. And we're going to fix it. We're going to fix it. We're going to do whatever it takes to fix it.
Next question.
Your next question comes from Travis Danraj with Global News. Please go ahead.
Hi there, Premier. I'm going to be a little bit long-winded today because I think some of these allegations, some of the observations, that is, are important to point out. Soiled residents not being changed, leading to skin breakdown. Little to no disinfection of facilities. Pressure ulcers due to little or no turning of bedridden patients. Cockroaches and insect infestation. Forceful feeding causing audible choking. And on and on and on. You said that you're horrified by this. You are in charge. You're ultimately the boss.
Yep.
Did you fail seniors in this province? I know that you talk about this as a system that's needed to be changed for some time, but you have been the premier for some time. And families that have had loved ones die, families that still have loved ones in these facilities, would like some answers and some accountability. So did you fail seniors in this province?
I don't feel our government failed seniors. Matter of fact, we saved a lot of lives by doing what we did, putting actions in place, by calling in the military, by calling in public health, by getting hospitals in there to support them. Travis, you've been around long enough. You understand this system was broken. I take full accountability for the system that we inherited. But I can tell you, I'm going to fix this system. I'm going to fix this system no matter what it takes. But you're right. The buck stops with me, and I take ownership. I take full ownership of this. But it's a system that just doesn't affect Ontario. You've seen what's happening in Quebec. You're seeing what's happening across the country. And just because we have the largest population, you're really seeing it in Ontario. But we're going to make sure we fix it. Travis, I came up here over and over and over again saying the system was broken. Do we know the absolute extent until I read this report? Not at all. I didn't know the deep, deep roots of it. Did I know the system's broken? 100%. But I can tell you, no matter what it takes, we're going to fix this system.
But Premier, there are other provinces that have taken over long-term care. Do you think it is time now, considering all of these very shocking, very horrifying observations that the military had to find out and the federal government had to let you know about, do you think it's now time for the province to take over long-term care and integrate long-term care into the public health system?
Well, I can tell you the system's broken and everything's on the table, Travis. I'll do whatever it takes. If that's what it takes, that's what we will do. Again, I'm putting everything on the table here. The public needs to know exactly what I found out yesterday afternoon. After the press conference, I got briefed on this, and it was gut-wrenching. When I say gut-wrenching, I was up, and I'm sure everyone was up. I was up all night thinking of this. You know, the families that go in there, you know, and they see their loved ones and they see this report. You know, I get it. You know, it's heart-wrenching. You want to go in there and get your loved one and take them out and protect them. And when COVID came into these homes, not only did it affect patients, it affected workers, and a lot of workers were scared to show up to work. We had to get other people in. We had to get volunteers. We had to get public health in. And there was a crisis. And I've said there's a crisis in these long-term care homes. The question is, how are we going to fix the problem? We will fix the problem with the support of the federal government. We need to revamp this situation, because I can stand here right now and tell you, I'm sure Ontario is not the only province that has crisis in long-term care. Has it come to the top in other provinces? Maybe because they're smaller provinces? No, it might not have come to the top. But you see what's happening in Quebec? They're facing the same struggles, even worse struggles than Ontario has. But it's unacceptable. You know, I think it's appalling. I think it's disgusting what has happened. Just the dignity of these patients in long-term care not being cleaned. These are just standard operating procedures to clean someone. When you feed them, you lift them up. I'm not an expert in health, but I know when you feed someone, you lift them up and feed them. It's so disturbing when I read this. It was hard to get through. It was the worst report, most heart-wrenching report I have ever read in my entire life, ever. But we're gonna fix this, Travis. I promise you, and I promise the people of Ontario.
Next question.
Your next question comes from Lisa Zing, CBC News. Please go.
Hi there, Premier. Obviously, you know, an emotional issue for a lot of people. I see you're emotional as well. You know, the people who have died, when we see these numbers and the conditions, people being force-fed and left to cry for help for 2 hours, that's someone's mom or dad,
Sure.
sister or brother. So what do you have to say to the families who are actually living through this?
It's heartbreaking. It's heart-wrenching, but there's going to be justice. There's going to be accountability. That's what I'm going to tell them, or I'm telling them right now. We're going to get down to the bottom of it. To leave someone that has fallen out of the bed and just leave them there, or simply not cleaning someone, it's appalling. It's absolutely appalling. How can you leave a loved one? Relate to your family. Relate to a mom or a dad what you would do for your family. I would do anything for my mother. You know, as I've said, my mother-in-law's in there. You know, Carla's just absolutely beside herself, along with 70,000 other families are beside themselves, wanting to run in there. As she said, I don't care. I'm going to get my mother. You know, that's the first instinct. Go save your mom or your dad. That's the instinct. Sorry.
Thanks very much. And my follow-up question is for the Minister of Long-Term Care.
Yeah.
So I guess the province was briefed, on the full extent of this issue. The Premier said yesterday, but the province has also been saying that, this has been a long-standing issue. So my question is, why exactly did it take this military report and the military stepping in for you to fully understand the extent of the issues at even just the 5 homes during COVID-19 specifically?
So let me give you a little bit of context. Going back 15, 20 years, I started as a physician actually in long-term care in the 1980s, and I know it from a personal level as well. And so the context of what has happened over 15 years, 20 years, as our population aged, as the staffing became more problematic into a crisis just before COVID, that had been on my radar. And as a Minister of Long-Term Care, I was looking to address that. We had an expert panel for a staffing study to really inform a comprehensive staffing program. And as well, looking at the Justice Scalise recommendations from the previous public inquiry that was reported on in the summer of last year. Looking at all of that and understanding we had an aging population as well. So, and we're aging across the country. This is a national issue. This is something that everyone has known about for years. Our population is aging. Long-term care was ignored. Long-term care was neglected. I came here and had the privilege of becoming Ontario's Minister of Long-Term Care, the only Minister of Long-Term Care in all of Canada, thanks to Premier Ford. We were shining the light on this. We were looking at fixing a system that had been neglected and ignored for decades. And then COVID. And COVID tipped the homes that were having difficulties with staffing already right over the edge. And we were monitoring, and it comes on quickly. When COVID hits a home, it comes on quickly. And we were monitoring, we had our command table, Ontario Health involved, our hospitals involved, the public health involved, the infection prevention and control teams out, our rapid response teams, looking at everything we could do to help these homes. And then it came to the point where we needed to call in the Canadian Armed Forces. We were monitoring and watching. These homes had multiple inspections. Every year they have an inspection. There were almost 3,000 inspections last year. We also have inspections based on need that is done through any information that comes through an action line for families and residents and staff. So this has been something a long time coming. And I am determined, our government is determined and committed to fix this problem once and for all. And that's why we're going to have a commission. We also have short-term solutions, medium-term solutions, and long-term solutions. It's absolutely essential. I'm glad that the Armed Forces has demonstrated this. I value their report. It's gut-wrenching, as has been said. Canadians cannot tolerate this. We need all levels of government to come together. Thank you.
Next question.
Your next question comes from Robert Benzie with the Toronto Star. Please go ahead.
Hi, Premier. I understand that you and the minister are very upset by the revelations, but the province has had an inspection system all the years that you've been Premier, all the years that you've been in government, the previous government was in office. Didn't the inspections ever reveal anything, and are you going to have to revamp that system given that it didn't expose those problems?
Well, I'll tell you, we're going to revamp everything, but the best person to answer this, Robert, is the Minister of Long-Term Care. I'll pass it over.
So looking at the inspections overall, the Auditor General had a report, and on the heels of that, the inspection process was changed to a risk-based assessment. and inspections. But we have 175 long-term care inspectors. They're out investigating and inspecting homes. They also provide a point person for any home needing PPE or support or staffing. But I want to be clear, there's multiple layers of inspections that are done, and I think it's very important that this carry on. COVID, as I said, tipped our homes over the brink. This is an unprecedented tragedy across Ontario, Canada, and the world. So we are in an unprecedented situation, but we need to evaluate everything and understand how we move forward, making sure that our residents in long-term care are treated with respect and dignity, and the staff get the support that they need.
And back to the Premier. Premier, you said that everything is on the table in terms of what you're going to do to reform the system. Does that include having a publicly funded, publicly run, publicly operated long-term care system, so you no longer have private homes, so that it's just a system like we have with our hospitals? Is that what you want to see down the road?
Well, Robert, once we get it in front of the table and we get every single detail, that decision will be made. As you know, Robert, we financially wouldn't be able to sustain that. Now, if the federal government comes in to support us, that will make it more sustainable. And I just want to mention, I don't want to paint a broad brush on 626 long-term care homes, because it's just not fair. Is there an issue? Absolutely, there's an issue. Was there a massive issue with these 5? Yes, there was. But I think it would be unfair to paint a broad brush right across the entire system, because the vast majority of the homes haven't had an outbreak, but everything needs to be inspected. It's a simple thing, Robert. As our parents teach you a lot of things, I never forget what my dad told me. He said, I had 9 brothers and sisters, or 9 kids, 9 including himself, and his father died. He was the youngest of 9, and he said, you know something, even though my mom didn't have money, it didn't cost that much to keep a clean house. And same with our factory. He says, it doesn't cost that much money to keep something clean. I see the same thing in long-term care. It doesn't cost that much money to make sure things are sanitized and there's a clean working environment for people to work in, and especially the patients. And that's one of many things we need to focus on. And you read that report, Robert, you see a lot of it is cleanliness, just simple cleanliness, that you can go in there and just keep the place clean. But these are the items that we're gonna be all over, and we're gonna fix this.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Premier, I asked
Right.
this question to the officials in the technical briefing, and quite frankly, they tried to pass off BS and bafflegab instead of giving a real answer. So I'm hoping that you and Minister Fullerton can both answer this. Why did it take the military going into these 5 homes to highlight these problems? If these were some of the worst hit homes in Ontario that required you to ask the federal government to send in the military, why, in the name of everything, why did you not know that there were these problems?
I'll tell you what I know, and I've always told the public what I know. I know that there was a crisis. I know the system that we inherited was totally broken, and we asked for support from public health. They went in there. That wasn't enough. We called the hospitals, local hospitals, to help us. They went in there, made sure Ontario Health was there, and we asked for volunteers. And the only answer I can really be clear on is yes, inspections happen, and these folks come in there, but it took the military to be there 24/7 every single day until you live, breathe, eat it, and you're there 24/7. You could have an inspection in there for a couple days, 3 days, a week, but until you're there around the clock at nighttime and during the day, I said that story, and I don't want to sidetrack at all, Brian, but when I saw there was some crisis in palliative care when my brother Rob was in there and there was 1 or 2 nurses trying to take care of, 20, 30 patients at nighttime. You don't realize it until you're there late at night and you watch the system go around the clock. And when he fell out of bed, thank God I was there, but we had no one to get him back in bed. That's when you find out there's cracks in the system by living the system around the clock every single day. Then you really find out what is going on. And then you also have the military that's accountable to the general and the federal government. Not being threatened, and I'm not saying anyone's being threatened, by the way, but not feeling intimidated if they go out and say there's massive problems in the place I work. That's my opinion. That's what I'm taking from this over the last 24 hours. And you need someone very transparent, like the military, to go in there and say, here are the goods, as ugly and as heartbreaking it is, here it is. That's where you get the real answers. And that's why I'm requesting, we need the military for another 30 days. We appreciate the brave men and women that serve. And I mentioned that to the general yesterday and this morning, and I just can't thank him enough, and all the men and women that went in there. I understand they're still in Quebec. We need the same.
So, Premier, as a follow-up, you said that the public should know all the information that
Yes.
you know within 24 hours of you finding it out.
Mhm.
You mentioned yesterday that you're tracking by postal codes, that there are select hotspots, and yet your office, your government refuses to release information by postal codes. Why did that seems to go against exactly what you're saying? Why won't you release that information?
Well, I think anyone, you look in public health, it's public information where the hot spots are. I don't want to stigmatize one certain, 10 streets, but people know where the hot spots are. I mentioned them yesterday. I can pass this over to the Minister of Health. Thank you.
Well, certainly, public health is aware of these hotspots. They are in there. They are doing the work that needs to be done to increase the testing, doing the contact tracing, and follow-up. But in terms of identifying the hotspots to everyone, it could be very difficult. It could be very stigmatizing for that area to be identified as a hotspot area. It may be because of socioeconomic reasons. There may be other reasons that come into it, separate and apart from just the separate public health aspect. In additional ways, it could be very difficult for businesses that are trying to come back to be identified as becoming from a hotspot area. We want to make sure that everyone has an opportunity to reopen successfully. So the situation is being dealt with by the public health units, but it's a situation where you have to balance the public's awareness and right to know with, on the other side, the demoralizing and stigmatizing effect that this could have on that particular area in question. So we want to do the right thing. We're doing the work there. We're doing the testing and the contact tracing.
Next question.
Your next question comes from Julianne Lemarax with Radio Canada. Please go ahead.
Yes, good afternoon, Premier. Good
Julianne.
afternoon, ministers. You seem very surprised by the report that you read, Premier, but a recent class action suit on behalf of family members of the residents of Orchard Villa suggests your government was aware of serious complaints of abuse and neglect at that home. So why didn't you act sooner?
Well, as soon as we got a report on Orchard Villa, we sent people in immediately. I was talking to the MPP, the local MPP, that night at 11 o'clock at night, and we ended up getting the hospital in there immediately. But to the extent and the details that we've seen in these reports, and they've stabilized these 5 homes for now, but we have to make sure we still have a lot of work to do. But we sent in the hospital, sent in public health, sent in Ontario Health. We had volunteers go into that home. We ended up finally calling the military in, and we did everything we could. There was nothing we've held back, nothing when it comes to supporting these homes. And it's terrible. It's terrible what has happened in these homes. Just terrible.
And I'm sure that a lot of families are horrified right now. They have a loved one in a long-term care home. Should should they go get their loved one and remove them from the home? Would they be safer if they were with their families?
Well, again, what I said earlier on, you can't paint a broad brush on 626 homes because the vast majority aren't infected. And we appreciate the work that those homes have done. But yes, is it concerning? As I said earlier, absolutely it's concerning. And I used our example. We're blessed. I think West Park, as far as I can see and what I've heard, they've done a very good job. But there are systems that haven't been implemented in these other 5 homes. And, you know, I could sit here. I don't believe in giving people excuses. I just don't. These are the reasons, and this is what we're going to do to fix it. And we are going to fix it. But we are leaving nothing on the table to have the resources go into these hospitals. Everything is on the table to make sure we fix a broken system that's been broken for decades. It's been broken for decades, and because of COVID-19, now this has come out. And you know, thank God for our military. That's all I can say. Thank you for the brave men and women that serve our country.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi there. My first question is for Health Minister Christine Elliott.
Yeah.
Minister, back in 2016, under the former government, you were appointed to be this province's patient ombudsman, and part of your responsibility was to look into complaints emerging from long-term care homes. Did these issues arise when you were the patient ombudsman? And if they did, why did you not highlight them when you became the health minister?
Well, I can't discuss the specific complaints that I received while I was patient ombudsman, but certainly we did have responsibility for issues relating to long-term care, hospitals, and home and community care. We did hear some complaints, generally speaking, with respect to care, coordination, staffing, all of those issues, but nothing to the extent that's been raised by this particular report. This report, prepared by the Armed Forces, is far beyond my knowledge at all of the circumstances and what was actually going on in some of these homes. But as the Premier indicated, we do have to remember that out of 626 long-term care homes in Ontario, there are hundreds that have never had outbreaks, that have provided excellent quality care to patients. So we need to concentrate our efforts on the homes that have been identified in this report, making sure that we do a complete investigation, and of course, fixing the system. And that is something that, as a government, we intend to do.
Thank you. And my next question is for the Premier. Premier, you've spoken quite at length today about the decades of neglect that contributed to the current situation at long-term care, but all of this that happened during COVID-19 has happened under your watch. You say the buck stops with you. You say you take full ownership. I'm wondering, what exactly does taking full ownership actually mean? People are, in the next few days, are going to be calling for resignations. Yeah. How do you hold your own government accountable? Will anyone resign over this?
Well, again, Colin, we've done a tremendous amount of work since we've taken office. And there's the system, again, is broken. When COVID hit our country, hit the world, there's a lot of things that came to the top. No matter if it was long-term care, be it our health system, our procurement system, that's where you see the cracks in the ship. And as a province, we need to do a better job. We need to do a better job. As much as we pulled in every single resource that, no matter what government was in power, we pulled in every resource we had to go into these homes. And I'll spare no expense to make sure we fix the system. That's what we're going to do. We're going to make sure we fix the system on these homes that have these issues. That's my laser. I'm going to be laser focused on this.
Last question.
Your final question comes from Cynthia Mulligan with City TV. Please go ahead.
Hi, Premier.
Hi, Cynthia.
It's not that hard to figure out what these long-standing systemic problems are in long-term care. There are no standards. There aren't enough staff. They're underpaid, they're undervalued, they're undertrained, and they're only given part-time hours. How quickly
do you pledge to turn that around? You don't need an inquiry or a commission to tell you these things.
I agree 100%, and that's what I've been saying right from the beginning. We know the system's broken, and when you get into the weeds and the details that I saw in this report, never in a million years would I think it would go to that extent. And I think when you read it or anyone reads this, I sat back and thought, how can this happen here in Ontario? How can it happen in Canada? Because again, this, as sure as I'm standing here, it isn't just happening here in Ontario, but it's all hands on deck. It's immediate action. We've already launched an investigation. By the time I was briefed yesterday, within hours, we had an investigation from the coroner's office. The coroner's office, what they come up with will be handed over to the police to look at if there's any criminal charges involved. As I always say, I can't direct the police, and they won't need direction. Once a coroner's report comes out, it'll be handed over to the police to determine if they need to do a further investigation and charges being laid for neglect.
Premier, you have mentioned a couple of times that we can't paint all of the 600 plus long-term care homes with the same brush, and I agree with you in principle. And you keep pointing to these 5, but we have heard from family members that it is far more widespread than just 5. Not too long ago, I spoke to a woman who said she saw her mother briefly through the window and she wasn't dressed properly. She clearly hadn't been bathed. She looked like she was starving and she was begging her to get her out of there. So how widespread do you think these serious systemic issues actually are?
Well, as soon as I mentioned this to the Prime Minister, and I don't believe it's just 5. We have to do a deep dive into all the homes, and we're going to need the resources to do that. And that's why I'm asking for the federal government to help us and support us, because I just don't believe. I don't believe it's all of them, but I believe there's more than 5. I believe there's more than 5 in this province, and I believe there's more than 5 in other large provinces, not so much maybe the small ones, but the large ones. And we need a system standard, as I say, SOP is a standard operating procedure that applies right across the country. No matter if it's in Quebec or Ontario or BC, we need a system that everyone goes by. And we have to put standard operating procedures and, trust but verify. And we need to do more verification. And this report says it all. And we have to do a deep dive. That means people staying there around the clock. I don't care what it takes. They can stay there around the clock and monitor these homes until we get it right.
Thank you.
Thank you, everyone.